Welcome, everybody, to our very first webinar for our Supporting Parents webinar series. Connie and I'm Jackie Eaton. I'm joined by my colleague, Connie Herman. We are so excited to be able to connect with you that do such important work working with the families and the parents and children in the early years. As I mentioned, this is recorded, but we will be editing out any of the conversations so that when we're sharing it with other people, it will just be our presentation. I just want to take a moment to acknowledge the land. Myself and Connie, we are currently on Treaty 6 in the homeland of the Métis. And we both work at the Saskatchewan Prevention Institute, which is located in Saskatoon on the beautiful lands of the Indigenous peoples who have lived here since time immemorial. They include the Nahiawak, Nahiawak, Nahinawak, Ananishbek, Nekaway, Nakota, Lakota, Dakota, and Dene peoples, as well as the Métis. The Saskatchewan Prevention Institute is a provincial organization, and we provide services to Treaties 2, 4, 5, 6, 8, 10, and are committed to living in good relations with our Indigenous neighbors in the spirit which the treaties were intended. At the Prevention Institute, we are committed to understanding the history of colonialism and playing a positive role in the important process of truth and reconciliation. So I invite you, if you so choose, to share in the chat what treaty land you are currently participating in.
As Jackie mentioned, we're very excited to be here today. Thank you, everybody, for putting your treaties in the chat, and we welcome you all from across Saskatchewan, and I think there's even a few people from other parts of Canada. So thank you for joining us today. Our objectives today are to discuss related programs, resources, and services from the Saskatchewan Prevention Institute. One of the things we realized is that we do a lot of presentations, a lot of workshops and trainings, but we don't end up really spending much time talking about the Prevention Institute and the work that we do and the wide variety of resources that we have. So we're happy today to be able to share some of the time that we have together to really dive a little bit into the resources and kind of guide you to those resources and talk about how you can use them in the work that you do. And our other objective is to explore the various ways in which we all play a part in supporting healthy child development. One of our roles is to support you as service providers, and we really recognize like the amazing work that you do in your communities, and we want to celebrate that, and then start to explore ways that we work together and can continue to work together, and ways that we can continue to support you. And finally, we want to highlight the Supporting Parents webinar series, which is very new. This is kind of the launch for that. And we want to talk to you about what that's going to look like and the ways that this series can support you in the work that you do. So there'll be a series of sessions, and it really is designed as a tool that you can use in your work. So the Saskatchewan Prevention Institute, I'm hoping that most of you have heard of us before and are familiar with us. Our main mandate is to help all children thrive, and we do that through primary prevention and promotion of well-being. Our goal is healthy children, so we have a variety of different programs that support that. We are a provincial nonprofit organization that has been in existence for almost 40 years. Our mandate, as I mentioned, is to help children thrive. We help do that through a variety of different ways, different programs, supporting parents and supporting service providers to promote healthy child development. We have a variety of areas that focus on things such as FASD prevention, child injury prevention, child traffic safety, sexual and reproductive health, perinatal infant health, early childhood mental health, and parenting. So that includes the CAPC and the Nobody's Perfect programs. As we go through this next section, we're going to highlight these programs, and we're going to be sharing some of the resources that you can access on our website. Almost all of our resources are free and downloadable. There are a few that you have to pay for, but most of them are free and downloadable, and we do send out those resources to you. You can order them. The only thing we don't cover is shipping and handling.
All right. So one of the first programs that we'll talk a little bit about is our Child Injury Prevention Program. And this program's goal is to raise awareness of injury risks and best practices to reduce the number of injury-related deaths and decrease the risk of life-altering injury. So injuries remain a leading cause of death and hospitalization for children. And Saskatchewan, unfortunately, has a particularly high rate of child injury. So the vast majority of injuries are predictable and preventable. And so the Prevention Institute has worked very hard on creating a variety of resources, as well as providing different type of training opportunities that focus on preventing harms. So we have resources on preventing poisoning for children, the Protecting Children's Brain brochure has all the different ages 0 to 6 on different possibilities of injuries and how those can be prevented. We have a brochure on protecting babies' head shape. We do Bicycle Safety Week, so many of you may be familiar with that. And one of the resources that's been around for a little while but was recently updated was the Home Safety Tips. And we're so excited that our very first webinar for the Supporting Parents webinar series that you can use with parents will be focused on that. And Beth Blakely, our Child Injury Prevention Coordinator, will be sharing that in October. But we'll talk a little bit more about that in a bit. Another area that we work is child traffic safety. And this program really focuses on helping parents understand and correctly installing their child car seats. And so we have a number of checklists that are available on our website that are focusing on rear-facing car seats, forward-facing, booster seats, and then information about that transition, a safe transition when your child is at the appropriate age, weight, and height for seat belts. We at the Prevention Institute organize the many car seat clinics, train car seat technicians, and so we try to reach the entire province. I know Jason, our program coordinator there, he's hardly ever in the office because he's on the road training other people and offering those clinics. So the goal of this program is to reduce death and injury to children that result from motor vehicle crashes. And it worked very, very closely with SGI, as well as many other programs that have car seat technicians. Also, a thing, if parents are wanting information on how to correctly install, they can come to the Prevention Institute as well and have a free car seat check as well.
And then another area is the early childhood mental health programs. And this is like one of the areas that we largely do from the side of our desks. There's not a lot of funding that goes into this, but it is a particular passion. For those of you who know Jackie and I, you will know that we love the My Curious Brain resource. And that's one of the things that we've been doing from the side of our desk for the last several years. And there's the My Curious Brain book and the resource room. The book is one of those resources that you do have to pay for because we don't have funding for that. It is a cost recovery resource. It talks about what happens in your brain, your bodies, and your behaviors and your emotions when you're experiencing stress. And then talks about the importance of co-regulation, particularly, and how the adults in children's lives need to be there to support their children to be regulated. So when COVID hit, we had some time to do the resource room, and that's where we developed the online virtual resource room. And that is a resource where you can actually go on, and if you click on the child reading the book, you can get a free version of the book. So that was one other way that we were trying to figure out, how can we get this into the hands of parents at no cost? And so this, along with the reading of the book, there's a song and various other videos and resources and downloadable sheets and coloring pages that people can use in their parenting programs or as teachers or working with children. We also have a variety of different postcards and information sheets, such as the ones that we're showing here about how your child's brain develops or nurturing childhood mental health. And then there's the FASD program, which is a big part of our Prevention Institute. We've been actively working in the area of FASD prevention since 1980. So hopefully some of you were able to get out yesterday and go on the walk for supporting FASD. FASD is the leading cause of developmental and cognitive disabilities among Canadian children. Approximately 1 in 100 Canadians are diagnosed with FASD, and as many as 1 in 20 people may be affected. FASD is a complex public health, economic, and social issue, and primary prevention projects focus on increasing public and professional education and awareness. The overall goal of this program is to decrease the prevalence of FASD in Saskatchewan. So we have lots of resources to support this. We also do different trainings such as motivational interviewing and FASD awareness training. We also have a specific part of this program is focused on working with youth. So that's the YAP program, or Youth Action for Prevention. And within there, there's lots of resources that are geared towards working with youth, specifically on things like mental health. And we have just recently started up the training, Opening Doors to Difficult Conversations. So having those conversations with youth, and how do you go about that? So supporting adult allies to work with youth.
All right. Another program that the Institute has is the Perinatal and Infant Health Program. And this program promotes best practices for maternal health and the prevention and reduction of infant illness, disability, and death. This program provides evidence-based resources and current best practices to ensure the healthiest outcomes for a woman and her baby before, during, and after pregnancy. Perinatal infant health focuses on areas such as environmental health, maternal healthy weight, as well as maternal oral health. So the goal of this program is to improve maternal and infant health in Saskatchewan through a coordinated population health approach. And we have a variety of different resources that are available for parents or expectant parents. So we have focus on healthy weight gain. We have a beautiful booklet that was done in collaboration with many service providers and healthcare providers around the province. We have some resources on safe sleeping for babies. And one of the one of the most interesting I find, and I'll tell you why in a moment, but we have an app that's focused on My Saskatchewan Pregnancy. And so this is a free app that is available from, you can go to your app store or the Play Store if you have an Android. And it has information with reminders. There's a journal that you can access. There's videos, as well as there's links that will take you to supports across the province. And if you need a little bit more information, and there's some videos. I just recently became a grandma. And so when I found out my daughter was pregnant, I said, you need to download the Prevention Institute's app because there's a lot of information on there that is of great interest to people expecting a baby. Another section that's included in that perinatal infant health section is a focus on parental mental health. And we have some resources that are specific on maternal mental health, including some questions for screening, as well as links to available supports for people that may need some extra support around mental health screening. And we have, as Connie mentioned, all our resources are evidence-based. And so we work very hard with the people that have the expertise in these areas or looking at other peer-reviewed resources to be sure that we're sharing the information that is correct. Another program, and I used to work in this program before I became the CAPC Training and Education Coordinator, is their Sexual and Reproductive Health section. And this program, our goal is to promote the importance of and bring about improvements in sexual and reproductive health. So we explore creative ways and effective methods of reaching people, talking about sexual and reproductive health, and reminding people that sexual and reproductive health is a part of overall health. So we have a variety of different areas that we work in that program, including looking at the impact of sexually transmitted infections on fertility, looking at HIV and pregnancy. But one of the sections that I am very excited about is the work on helping parents have conversations with their children about sexual health and how to have a healthy sexual and reproductive health. And so we have a video called It's Easier Than You Think, the 10 tips for talking to kids about sexual health. There's a booklet that goes along with that. We have a variety of different message cards right from birth up until age 16, talking about what is healthy sexual development and how can you prevent sexual harms that could potentially occur from children, as well as we have a couple of children's books that focus on teaching children about the correct names for their body parts.
And then our programs, the parenting programs. So this is the area that Jackie and I work in mostly. So I am the Nobody's Perfect program coordinator for Saskatchewan. Nobody's Perfect is a Public Health Agency of Canada program that has been around since the 80s. And Jackie's program, CAPC, is also a Public Health Agency of Canada program. Nobody's Perfect is an educational and support program for parents of children who have parents who have children ages 0 to 5. And our goal is to support parents to enhance knowledge, skills, and self-confidence. So these are vital areas to healthy and effective parenting. We encourage the development of a strong and supportive social network among our participants. So for those of you who have taken the training, that sense of community and coming together and working together is really important. And we try to model that for when people are working with their parents. We aim to meet the needs of young people, young parents, single parents, parents who are facing barriers in various areas of life. And then CAPC is a national program that has gotten long-term funding to community groups to help promote the health and development of children ages 0 to 6. Through community-based primary prevention and early intervention programs, CAPC serves children and families who are at risk for poor health outcomes. The Prevention Institute sponsors both of the CAPC program and the Nobody's Perfect program. The CAPC goal is to support the education, training, and networking needs of other CAPC projects in Saskatchewan. So that's Jackie supports service providers working with parents. These are some of our resources. One that we really want to highlight is the Healthy Parenting Program. Again, this is another one that's just kind of on the side of our desk. We don't get a lot of funding for, and we don't often get that chance to promote this program, but we really want to highlight it here today. It is a free online resource that parents can access or that service providers can use to support parents. And as parents go through the different modules, they can do quizzes at the end of each module. And then once they're completed the program, they can get a certificate. So that's something that is very important to a lot of parents. And we just wanted to highlight that here. Again, that website, I'll put that in the chat. It's just www.healthyparenting.ca. And that's a program that's been around for a long time and has a lot of different modules in it. You do not have to be a Saskatchewan parent to take the course. It's free for anybody. And then we have a variety of other resources. I really love the Cherish Me for I Am a Child. It's been around forever, but it's just kind of a little poster that people can and those again are free. So all of these are free. The bookmark there in the middle is free. So free and downloadable. If there are other resources as you're going through here that you're thinking, I think our community really needs this, please reach out to us and let us know as well. One of our roles is to respond to community's needs. So we are always looking for other resources to develop and to support the work that you're doing. So this is another resource that's fairly new to the Prevention Institute. We probably about a year or two ago, we're working on developing some core stories. So core stories are a way to share a story, a metaphor, that promotes a positive message that is kind of a universal message that we want to get out there. So one of those is the pieces of the puzzle from a child's perspective. So this core story particularly focuses in on all the roles that people play to support healthy child development. So there's so many different things out there that are supporting healthy child development, and we just wanted to kind of take some time to honor that and to help other people think about what role do you play, to take some time to reflect on that. So we're going to share this video, and then we're going to do some small group work and have a little bit of a discussion about the pieces of the puzzle that you play.
There are so many pieces of the puzzle that help me and children everywhere to grow up healthy and happy. And I would like to give thanks for a few. Thank you to Canada for recognizing that I have special rights as a child, and to all of the people who make these rights come true. Thanks to the judges, police, emergency workers, and traffic safety people who help me feel safe. And to the doctors, dentists, and nurses who help me grow healthy and strong. Thank you to the people who build and care for the parks, slides, and swingers so that I can play, explore, and have fun. Thanks to the people who help my family to have healthy food, clean water, and a home. Thank you to childcare workers, early learning people, teachers, and coaches. You help my brain grow, my body get strong, and my imagination soar. Thank you to everyone in my community for teaching me about myself, my culture, and making me feel like I belong. And thank you to everybody I live with, and to all the grandparents, aunties, uncles, sisters, brothers, and babysitters. Thank you for your love and the countless ways that you care for me.
It takes a village to invest in the early years. We all play a piece of the puzzle to ensure that children's rights and needs are met so children can thrive. What piece do you play?
All right. So I want you guys just to take a second, or a couple seconds, and write down on a piece of paper, if you have one, about the different pieces that you play. And we're going to put you into groups.
But we just want for all of you to connect with one another and talk about what are the similarities that you have that, you know, it may be through your work. And so for Connie and I, for example, we both work at the Saskatchewan Prevention Institute, and we both support service providers that work with families and children in the early years. And we are also both parents. And then looking at what are your unique things. So there are different things that maybe you work with a certain population, maybe you work specifically with fathers, or maybe that you work only with children, or only with mothers. And so in our cases, our individual thing, and I just am excited for those of you who've seen me over the last couple of months, I'm a grandma. And I'm so excited. I have the most beautiful grandbaby in the world. So that's my unique thing. And then Connie, she used to work as a crisis counselor prior to being at the Saskatchewan Prevention Institute. So when we put you into your groups, you're going to just talk about, you know, find maybe 3 different things that are similarities among you, and then just share something individual. So maybe that has something to do with your work, or maybe it is something personal that you want to share that is a unique thing for yourself.
We are going to be sharing a series of different webinars. The first one coming up in October 9th from 10:30 to 11:30. And actually we have Beth here. Beth is our child injury prevention worker, and she will be talking with people about home safety tips, preventing childhood injuries. Our webinars, what they're going to kind of look like is that they're going to be available for service providers and parents. So it'll kind of be geared towards parents, really, and supporting them. So if you think like a parenting program, think kind of Nobody's Perfect, for those of you who are familiar with that, it'll kind of have a little bit of that feel to it. And the idea is that service providers can join right at the time of the session, and they can bring parents with them. So even if you're doing it in one location, if you have access to internet, then you could share it there, and you could have small group discussions within there. There'll be small group, like those experiential activities, and then opportunities for discussion and reflection. And they'll be on a series of different topics. Again, the first one being home safety. The second one will be on another core story that we've developed, which is called The Wonderful World of Parenting. And that's about all the different parenting roles and responsibilities that parents play. That's December 10th. And we'll be having some discussions and activities around those. And then February 11th is getting into the stress awareness and My Curious Brain. And so those are kind of our first few. And then there's another one on healthy habits that will be March 4th. And so you can do this these sessions right then. You can also just offer parents the link. If they want to join on their own, they will be able to just join on their own. We have decided to do the recording ahead of time for the other sessions so that we don't record sessions with parents. That was a thing that we were like, well, how do we make this as safe as possible for parents? So the other sessions where parents come will not be recorded. So we'll be able to have group discussions where there isn't that fear of being recorded. Well, thank you everyone for coming to this information session. If you have any questions, you can stick around. Jackie and I will be here, and or you can email us. I'll just put my email in here. Just cprevention.ca. All right, well, have a great rest of the day. Thanks
Thanks
for
everybody.
coming out.